Hi guys, welcome back. We're gonna talk about the labor. So we have four stages: one, two, three, 4. So first stage of labor is from onset of true labor pain till full dilatation of the cervix. It is 10 centimeters. Second stage is again 10 centimeter of cervical dilatation till delivery of baby. Third stage is from baby to delivery of the placenta. And the fourth stage is known as the observation stage. Okay, so in this we are going to observe the mother, and also we are going to observe the baby, and also we want to see is there any PPH. Very important here. So we're going to talk about the first phase of labor, right? So whenever we're talking about the first stage of labor, right? Okay, the first stage is divided into two types, right? It is either latent or, and then it goes to active. Is that right? Okay, so in latent phase you have to remember it is 3 centimeter or less. Then and only we say it is in latent phase. In active phase we say 4 centimeter or more. What is this? Cervical dilatation. Okay, cervical dilatation. Is that right? Okay, so please remember in this latent phase only we are supposed to give tocolytics. We cannot give tocolytics later. If we give tocolytics in the active phase, it's going to fail, because if the contraction is so strong here, we cannot stop this uterus from delivering the baby if it goes to active phase. So tocolytics definitely you have to give in the latent phase, right? Okay, so now we're going to talk about the active phase. Now remember, how are you going to tell in active phase? Active phase is again 3 subtypes. Okay, acceleration phase of maximum slope, and we have deceleration. This is explained by the help of a graph, right? Please remember, during 4 to 8 centimeter we are having the highest amount of contraction. Increase amount of contraction during 4 to 8 centimeters of dilatation, right? One more thing you have to remember, please remember the rate of dilatation. In primary gravida is around 1.2 centimeter per hour. In multigravida it's around 1.5 centimeter per hour. This is what you have to remember. Along with this, please remember, if what happens is, if your latent phase, right, if more than 14 hours in multi or more than 20 hours in para, we say it is prolonged latent phase. Is that right? So this is very important, right? Now how we are going to tell the person is in latent phase? Obviously by looking at the cervical dilatation. With this you will be having irregular contraction. Whenever you try to feel the contraction, you will be having irregular contraction. Along with this contraction will be not very painful, or maybe painless also, and it will be not strong, and it is not increasing in intensity, right? Very important, you know, to differentiate true labor pain and false, right? True means the intensity will be increasing, the pain will be increasing, will not be reduced by taking painkillers, right? You will be able to see the fetal pulse, bag of membranes will be formed, the cervical dilatation will be you will be able to see the cervical dilation taking place. Wilson's falls, you will be able to see there will be the intensity will not be increasing, there will be no frequency will not be increasing, the pain will not be increasing so much, the pain will be reduced by giving painkillers. Along with this, whenever you see, there will just be dull kind of pain, but in true labor pain, the pain will radiate towards the leg, lower back, and everywhere, right? That is how you differentiate true labor pain and false labor pain, right? Okay. Another thing that we have to see here is that I told you about the tocolytics, right? So remember, if the week of gestation is 34 and less than 3 centimeter, this is the time you should give tocolytics. After this, there is no value. If you go more than 34, the lungs are almost matured, so you don't need to give so much of tocolytics, right? And if less than 3 centimeters, very effective. After 3 centimeters, if you give, it's not going to work because the contraction will be so hard that it's not going to work out, right? Okay, so another thing we want to know about is whenever you're talking about this tocolytics, we want to say about preterm babies. Now, what is preterm? Less than 37 weeks is preterm. Okay, less than 37 weeks is preterm. What is the normal? Normal is 37 to 42. So I want my pregnancy it should go around this is the best time for a delivery. Less than 37 weeks of gestation is known as preterm, right? Now, very important. Now you might want to ask, what is the cause of preterm? What are the causes of preterm baby? Why in the first place will I have preterm baby? Very important is urinary tract infection. Urinary tract infection, very important. Obviously, it's very common in females. Obviously, females will be pregnant. So, if you're having urinary tract infection, you will be having high chance of preterm. Very important is pelvic inflammatory disease, right? Pelvic inflammatory disease. But please remember, this pelvic inflammatory disease, if the female is pregnant, that time we do not call it as pelvic inflammatory disease. We call that time is chorioamnitis. Okay, but if the female is not pregnant and she is having this, we will say that time we will say pelvic inflammatory disease. Both are same. Pelvic inflammatory disease and chorioamnitis is same. Only we say it chorioamnitis if the female is pregnant. If she is not pregnant, we say PID. That is pelvic inflammatory disease. Okay. Another cause, very important cause, anatomical cause. Right now, what are the anatomical cause? If the uterus is not well formed, if it is a bicornate uterus, if the cervix is short cervix, what is a short cervix? Less than 2.5 centimeter, right? And you have unicornate uterus, bicornate uterus, and if it is an over distension of the uterus, very important. If it is twin pregnancy, triple pregnancy, polyhydramnios, obviously there's more amount, right? The body will try to throw it out as fast as possible, right? And why about the short cervix? Please remember, whenever you're having the uterus, right, it's somewhat like this, right? First there will be effacement and then it will start to dilate. Just imagine I'm holding this, right? This is my uterus, right? This my palm is the cervix. The cervix has to become effaced, right? This is known as effacement. Imagine my palm is smaller. If it is smaller, it will efface much more faster, right? So this is known as effacement. Once this effacement is done, then it is going to dilate. Then it is going to open up. Then it will open up to 10 centimeters. Right, so this is known as effacement and then it's going to open up. Remember, this is my cervix and this is my uterus, right? Uterus, cervix, effacement, dilatation. Very important. And very important is this. In the upcoming video, I'll tell you why do females have high chances of pelvic organ prolapse. Please understand, if the baby is inside and the cervix has not effaced, right? And it is, let's say, half effaced, and then the mother starts to push the baby, right? Obviously there is contraction, but there is one phase it comes that is known as bearing down, in which the mother's abdomen will start to push. The mother will itself try to push because the normal contraction is not adequate enough to throw out the baby, right? At that time the mother will start to bear down. That is known as bearing down, or the mother will try to contract by herself, giving her own effort. This has to be always done after the cervix is effaced. If you do at this time, the cervix will be pulled forward, will be pushed forward, so it will damage the cervix and will damage the ligament. So later on, when the mother becomes around 50 years, she will be having pelvic organ prolapse. Yes, The damage was done during the labor time only, maybe 25, 30 years, 35 years, whatever this age she delivered the baby. But why not? She will have the pelvic organ prolapse because the very, very important factor is estrogen. Estrogen will not allow you to have the prolapse. Once the estrogen level is gone, obviously the damage was already there, but this damage was compensated by having a higher amount of estrogen. Estrogen is gone, and then yes, 51 years, around 51 years, menopause will hit, estrogen level will come down, and this will suddenly come out, right? Pelvic organ prolapse. So very, very important is wrong conduct of labor, right? So do not start to bear down if the cervix is not fully effaced. Very, very important, right? Okay, so this was the small video about the first stage of labor. In next video we want to see how do we know a basic idea that the patient might go in the patient itself might go in preterm, right? If we are able to know the patient is going in preterm, we can take the intervention. It's very, very good. Now, very important, why are we giving tocolytics in the first place? We are giving tocolytics in order to get some time to give the steroid, and if the steroid gets 2 days of work time, it's perfectly fine. It's perfect. If not more than this, if you get 2 days of time, best. Let's say in certain circumstances you are able to give only for 1 day, and then the baby is delivered. Even at that circumstances, giving it for 1 day also is effective. Giving steroid is always effective than not giving the steroid in the first place. Maybe the steroid is able to work for 12 hours, still better outcome than not giving the steroid in the first place. Give the steroid as fast as possible, and we want giving the tocolytics to get us enough time and to buy us enough time for the steroid to work. 2 days, very good. Okay, so in the next video we want to talk about how do we expect the patient that might be going in labor and what are the interventions you can do in order to stop the labor. Thanks.